Jaundice is the name given to the yellow appearance of the skin and the whites of the eyes. Jaundice is common and normal in newborn babies, as is their body adapting to extrauterine life. It can be harder to see jaundice in babies with darker skin tones. Some babies who have jaundice may just need more help to feed effectively, and others may need treatment. It's important that new parents understand about jaundice and what to look out for, and this video is going to help you with this. To try and avoid your baby becoming jaundice, ensuring your baby is feeding effectively either on the breast or the bottle will ensure their milk intake is sufficient and therefore their nappy content is adequate. Babies excrete the substance that makes them jaundice in their urine and stools, so if they are feeding well, the jaundice should pass. Jaundice can often make your baby sleepy, but it is important to remember that a sleepy baby should be woken for feeds, as this will reduce jaundice and prevent excessive weight loss. Newborn babies should have a minimum of 8 to 12 feeds every 24 hours. Your midwife will be assessing the well-being of your baby and their feeding on a regular basis. However, if you are concerned, please ask for support from the midwife, as we can help put a plan in place. You should be given a feeding chart on admission to postnatal ward. This is useful to document your baby's feeds. This will help identify any feeding problems early so they can be resolved prior to your discharge home. On the reverse of this chart, there is a useful guide on feeding in the early days, which will also help you to assess the feeding yourself. If the midwife thinks your baby looks jaundice, there is a test we can do using this machine to check the jaundice levels in your baby's skin. This machine is placed onto your baby's forehead and it will flash 3 times. A number will appear on the screen and this is documented on a chart. This number will indicate whether your baby may require a blood test to check their blood jaundice level. If this is needed, the blood is taken from your baby's heel. You can cuddle or even feed your baby during this blood test to keep your baby calm and comforted. The result of this test will indicate whether your baby requires further treatment for jaundice. If further treatment is needed, your baby will be placed into an incubator in their nappy with a mask covering their eyes. The incubator is used to keep your baby warm. A blue light will then be placed over the incubator to provide treatment to your baby. This treatment is called phototherapy. This is not harmful for you or your baby. Regular blood tests will be performed to ensure your baby's jaundice levels are reducing. You will be supported with a feeding plan whilst your baby is under phototherapy. Please ensure you are still responding to your baby's feeding cues, feeding them as often as they wish. Sometimes some babies can be very unsettled in the incubator. If your baby wants a cuddle or to be fed, a billy blanket can be used to provide continued treatment to your baby whilst they are out of the incubator. There is further information on jaundice on the East Lancashire Hospital's infant feeding webpage, alongside contact numbers for your midwife if you are concerned your baby may be jaundice or you require more help with feeding.